Okay, welcome and thank you for joining us today. It's a pleasure to have you with us for this webinar, Strengthening Prevention Through Quality Standards, the example of the European Drug Prevention Quality Standards, EDPQS. We have an engaging and informative session ahead, and we are very much looking forward to sharing it with you. My name is Rasha Abihana. I'm the Scientific Support Coordinator at ISSUP Global and a Master Trainer of the European Prevention Curriculum recognized by the European Union Drugs Agency. Through the EUPC, I have also had the opportunity to present and discuss the EDPQS in training context, which makes today's topic particularly meaningful for me. While we are waiting for a few more to join us, I will begin by saying a little about ISSUP. ISSUP is a global membership organization that has just surpassed 50,000 members worldwide, bringing together professionals dedicated to substance use prevention, treatment, and recovery support. Our aim is to connect professionals through networking, knowledge exchange, and training, sharing the very best in evidence-informed ethical approaches and promoting quality in all areas of prevention, treatment, and recovery care practice. If you have not done so already, please head over to the ISSUP website, issup.net, where you will find information on how to sign up for a free membership. Now you can hear me?
Yes.
Okay, thank you, Angelina. It's the technology. Okay, so I was inviting you to join ISSUP.net, and I wanted to thank ISSUP staff for providing technical support for this event, especially our colleague Kojo, our digital event coordinator, who has done an exceptional job ensuring everything runs smoothly behind the scenes. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Please note that this webinar will be in English with interpretation available in Spanish. To access it, click on the interpreter headphones icon in the bottom right of your screen and select your preferred audio language. Once selected, it will replace the main webinar audio. You will have the opportunity to submit text questions to our presenter by typing your question into the questions pane of the webinar interface on your screen. You may send in your question at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. And if you miss anything, don't worry. A recording of this webinar will be made available for you to watch on demand after the event. And you can also share it with your network. We hope you will stay with us for what promises to be an illuminating session. Now I'm delighted to welcome you to today's ISSUP Global webinar. This session highlights quality as a cornerstone of effective drug prevention. As prevention systems continue to grow worldwide, ensuring that practice is grounded in clear and evidence-based quality standards is more important than ever. We will explore today EDPQS development, structure, and practical application while maintaining core principles. At ISSUP, prevention is a core priority, and through initiatives such as our Investing in Evidence-Based Prevention, IEP, training for policymakers, we support stronger decision-making and sustainable systems. So quality standards such as the EDPQS are fundamental to that mission. We are honored to have with us an excellent expert in the field. Our presenter, Dr. Angelina Brotherhood, is a prevention specialist with over 15 years of experience in substance use prevention, internationally recognized for her work on the European Drug Prevention Quality Standards. She has served on the board of the EU SPR and worked with the EUDA and UNODC on quality standards and training. Since 2021, Angelina has been working for the Austrian National Public Health Institute in Vienna. And on a personal note, I had the pleasure of meeting Angelina a couple of years ago during the European Prevention Curriculum training, as we are both EUPC European Master Trainers. It has been inspiring to connect through this shared commitment, Angelina, to strengthening prevention capacity. And I'm pleased to welcome you to today's session. The floor is yours.
Thank you very much, Rasha. I'm very pleased to be invited to this seminar and to be able to present these standards, which are very, very important, in fact, as I hope that I'll be able to convince you in a moment. Let me just try and share my screen. So we have, is it shared now?
Yes,
can you see
perfect.
it? Okay.
Yes.
And I'd also like to extend my welcome and hello to all the participants. I understand that we have participants from all over the world. So I'll try and speak slowly and clearly so that you can all follow along and so that the translation also works. Yes, a few words about me to start with. Rasha already said, perhaps in terms of my background, just to clarify that I'm a sociologist, I'm not a medical doctor. And another clarification, perhaps, that I'm only a national trainer for the UPC, not a master trainer, unfortunately. But surely that could happen as well one day. I have been working on standards development and dissemination for many, many years now, initially or mostly together with Harry Sumnall from Liverpool, John Moores University, who some of you might know, as well as many other colleagues. And these are the people who were, or these are the organizations who were part of the, we called ourselves the European Prevention Standards Partnership, that was active for 7 years to develop and disseminate standards. So we had quite a few organizations on board here. And if maybe some of these colleagues have joined today, then hello to you as well. Short funding acknowledgement and declaration. So the slides that I've done to that I'm presenting to you today actually use materials from previous projects that we worked on, as well as from the European Prevention Curriculum. So Rasha mentioned this already before, and I'll be mentioning it as well. The European Prevention Curriculum is based on the Universal Prevention Curriculum, the UPC, in case you know it. And in Europe, it's done as a 2 to 5 day long course that targets prevention decision makers and opinion makers and senior practitioners, let's say. And also some of the slides are taken from there. And in terms of conflict of interest, my prevention related work is entirely funded by government, so mostly the Austrian government at the moment, as well as the European Union. So what are we going to be covering today in the webinar? Why do we need standards? I'll show you some of the most important standards in our field in Europe, from a European perspective. And because EDPQS are the ones that I'm most familiar with, I'll talk about them in more detail. They're also what we teach on this European Prevention Curriculum, as Rasha mentioned. So I'll show you some of the contents. I'll talk about the development process and how you can use standards in practice. And Rasha asked me if I could talk a little bit more about how to go about developing standards if this is something that you want to pursue for your own, let's say, organization, for your own region, perhaps for your own country, in case you don't have any yet. And the standards have been, so the EDPQS standards have been around for 15 years now. They were published in 2011, so I'll finish with some brief reflections on what has happened since. In terms of the learning outcomes, by the end of the session, you should be able to have a better understanding of what standards can look like, why we need them, how you might use them, what to keep in mind when working with them, and also some practical ideas for how you could use them yourself. So why do we need standards at all? The word quality standards already elicits oftentimes so many negative associations. It's something abstract, something theoretical, something administrative. So it's not the most attractive or, let's say, sexy topic to talk about, but it is extremely relevant, because if we think about our aim as preventionists, and we're talking here about drug prevention, substance use prevention, our aim should be to offer target populations the best possible interventions while using our resources that we have efficiently, and just to make sure that we're all on the same page in terms of what we're actually trying to prevent. We're trying to prevent disease, death, and other negative consequences arising from substance use and substance use disorders. That could be, for example, violence or accidents. And we're not just doing this for the sake of it, we're doing it so that people can have happy and fulfilling lives and make positive contributions to society. And I think it's important to highlight this, because sometimes that gets lost and we get so caught up in doing the work that we forget what we're doing it for. And if we want to deliver, as I said, the best possible interventions, well, we have to know, we need to be able to distinguish which are the best possible ones from, well, the worst possible. So how do you know if a prevention activity is of high quality? And let's be honest, how do you even know if it's of minimum quality? If this was a workshop or a group discussion setting, we could have a long discussion about this and it would be an interesting one. But in this case, you get lucky, you don't have to say anything, I will give you the answer. Another thing to clarify is that what is shown on this slide here is not drug prevention. Making simplistic campaigns of just say no to drugs is not drug prevention. One-off events like picnic days at school, or let's organize a run against drugs, or let's have a drawing competition to show how dangerous cigarettes are, that is not drug prevention. And having sniffer dogs in schools is also not drug prevention. But unfortunately, these are the activities that we still see implemented in Europe and also implemented elsewhere around the world under the title of "This is drug prevention." And these activities do not prevent drug use per se. They might even harm children by perhaps increasing interest in drugs. And even if they're not effective or don't have any harmful outcome for the children, you know, and people might think, it doesn't hurt, so let's do it anyway. Well, there is always a cost, which is that instead of spending money on something effective, you're wasting money on ineffective approaches. But there are additional problems in practice, because even if we're using effective approaches, they can still fail if they were poorly planned and implemented, and if the contextual and structural conditions were not met or insufficient. And I'm using here this schematic overview of what a national drug prevention system could look like. You will find this in the UNODC WHO International Standards on Drug Prevention. It is one of my favorite diagrams on the planet. Some people hate it because it looks so complicated, but I think it shows really well what a drug prevention system might look like. And the important thing I want to highlight here is that interventions and policies are only one small component of a much bigger system. We tend to look at interventions and policies in isolation, but we need to look at them as part of a much bigger support system, of a much bigger context, where we, for example, also need training and legal and regulatory frameworks. We need all the stakeholders and actors who are involved in delivering this in a good way. We need data. So if these other aspects are not met, this is not going to work, even if we use really effective evidence-based interventions and policies. So what is good prevention and why does bad prevention happen? And I'm using this in inverted commas because, of course, things are more complicated, but let's have a go at it anyway. So if we talk to experts and read recommendations, high quality activities in prevention will look something like this. They will be relevant to the target populations and also to policy. They will be ethical. They will be based on scientific evidence of what works. Ideally, they will also provide some evidence of their own effectiveness, so they will produce some data. They are going to be cost effective, so using resources widely to achieve desired outcomes. They will be feasible and also sustainable. And the last point is worth mentioning because many great projects are just one-off pilot projects or the done ones and then finish. So again, that's also not ideal. So this is what the theory looks like. What do we find in practice? Often other considerations are more important, like low cost, or we fall for an unrealistic promise of a drug-free world. Even the proposed activities are unlikely to achieve this. Something that's fun, something where we can have nice photos, something that's easy and quick to do and doesn't need much time. You can see in that list, the actual quality and effectiveness is often kind of forgotten about. You can see this in the examples I showed earlier, you know, like the picnic or the run against drugs or the drawing competitions, they all fall kind of in this area. Unfortunately, actual prevention is often kind of boring and invisible rather than producing fantastic photos for the school newsletter. So hopefully now you can start to understand why we might need quality standards. And let me show you two really important ones that everybody should be aware of who works in this field. The UNODC WHO International Standards on Drug Use Prevention, I'm sure you're familiar with. I think they've been covered in other ISSUP webinars. And if you are now wondering, hey, she said not to do drawing competitions and prevention picnics, what should we do instead? Please have a look at this manual because it will tell you what to do in prevention, and it gives a really nice overview of options according to different life stages, settings, and levels of vulnerability. And also that nice National Drug Prevention System, you will find a chapter on that in this book. It's a great book, but we're not going to talk about it today. We're going to talk about the European Drug Prevention Quality Standards, which I was lucky to work on. And they don't tell us what to do in prevention, they tell us how to do prevention. And they give us criteria to recognize and ensure quality in prevention activities. And the beautiful thing about them is that no matter what you're doing in prevention, you can always use them. No matter what kind of activity you're doing, these standards will always have something of interest and relevance to you. So let me get to the content. We have two main resources for the EDPQS. There is a manual, which is a really thick book of almost 300 pages. And if you are a quality standards geek, you will be very happy with this book. It will make all your dreams come true in terms of levels of detail, and you know, you can get very enthusiastic about it. For the rest of the people working in this field, they will probably prefer our quick guide, which is only 38 pages, has lots of nice summaries and checklists. As you can see, most of it is empty space where you can write your own thoughts in. That's our most popular product, and it's available in over 15 languages. And you will be interested to know that these languages include not only English, but also Arabic, French, and Spanish. And they're available to download for free from the EUDA website. I'll show you the link later. What you will find in these documents is the structure is of a project cycle. And if you work in public health, you've seen these kind of cycles many times. And you know, there is a reason why they exist. They're quite handy for organizing content. And we have done it so that in the big book, each chapter, it's color-coded and corresponds to one of these project stages. And this is an ideal. So we know that in reality, projects don't always run through it like that, but the standards are aspirational. They describe an ideal situation. And one thing that is worth noting in this project cycle is that delivery and monitoring, delivery of an intervention comes at step 6. This is really important because it shows how much planning and preparation is actually required before we go out and speak to a real person. And what are you going to find in each of these project stages if you look through the chapters? We have cross-cutting considerations in the middle here that are about things that we always need to think of at any point in time around sustainability and funding, who we need to involve and speak to, make sure that our staff are well trained and engaged, supported, and also the ethics of drug prevention always should be considered as well. But then if we actually move through planning a project, we need to assess the needs, think about the needs of the target population and of policy of legislation. We need to think about what resources are available. So you can see that there are these components of quality within each of these project cycles. When we move on to formulating the program, we want to make sure that we have thought about who is our target population, what theories are we using, what are our goals, where do we want to do this, what kind of evidence are we using, what is the timeline. Then we're moving on to the details of intervention design, making sure that we have thought about how to ensure quality and effectiveness. If we're using an existing intervention, how can we make it relevant to the context and people that we will be working with? What needs to be tailored? At this point, we should also start planning final evaluations because we don't want to make the mistake of realizing after the intervention that it would have been good to evaluate it. We also need to start managing and mobilizing resources, be it financial, human resources, how we're going to get to the participants, and a bit of kind of basic project management. And then, as I said, only at this point do we then talk about delivery, where we would be implementing, monitoring, and adjusting the implementation. So there is some flexibility here as well to make sure that if you notice that it's not going well or you're not achieving your aims, which you would realize if you monitor, then you also have some space here to adjust what you're doing whilst you can. We have final evaluations in an ideal world where we would look at what we achieved and how we got there. So a distinction between outcomes and processes. And again, ideally, at the end of the project life cycle, so to speak, we're thinking about, should we sustain it? Should we change it? And we should also inform others about it so that they can learn from our experience. What you'll find in the manual for each of these components, you'll find some explanation, some introduction, why is this important, what should you keep in mind, and then the actual standards, where we distinguish two levels: basic for everybody and expert. This is for more for certain scenarios, or where if there is more money being invested, or it's a scaled up project. So this is what we'll find in terms of the content. Rasha also asked me to talk a little bit about the development, so I want to give you an overview of the timeline. This is all funded through the European Union, so we had a EU-funded project to develop the standards back in 2008 to 2010. And then we had follow-up projects. The manual and the quick guide were then published by what is now the European Drugs Agency. And then we've had follow-on projects to develop additional materials and training courses for dissemination and implementation. I have been involved in some of them, but not in all of them. So other colleagues took this work forward and to disseminate it. Another milestone that was achieved with a really great effort from a lot of people was to adopt a summary of the EDPQS as minimum quality standards by the EU member states in 2015. And the current situation is that they're being taught through the European Prevention Curriculum to thousands of professionals in Europe and beyond. Looking more into this point here, the standards development. So I mentioned it was a 2-year process, more or less, where we reviewed existing documents to summarize them or not summarize them, but to consolidate them, to put together many different standards that are already existing. This was also, for example, national funding criteria that are used in European countries. Then we used surveys and focus groups to discuss these standards and to refine them. This is how we came up with the project cycle structure. For example, people said that this is the best way to organize it. We talked about what is relevant, what is feasible, what should be a basic standard, what should be an expert standard. And overall, we spoke, not me personally with 400, but I also spoke to some people with over 400 professionals in 6 EU countries. So to have their opinion. So that's what led to the standards. And now you're wondering how to apply this in practice. So we have thought hard about who could use these documents and how, and we've identified 4 main groups. So there will be decision and policy makers, for example, in government and funding bodies. They're the ones who decide what gets funded and implemented. They're the ones who decide on the context in which interventions take place, like I showed you before in this prevention system. We have the practitioners who are implementing. They will also be taking some decisions, obviously, depending on how much freedom they have in choosing what they can offer. But primarily, they are also involved in the basic day-to-day implementation, and this could be NGOs, governmental prevention providers. And the third group is professional educators, for example, at universities, or who give continued professional development courses for these groups. So they are the ones who will be teaching about prevention science, for example, and they can also find it helpful to refer to quality standards. And I'll show you in a moment how. The fourth group is prevention coordinators, opinion makers, and prevention advocates. So this could be someone who's planning at a regional level or at a municipal level, what kind of activities should be undertaken to prevent substance use. And before I continue, take a moment to ask yourself, which group do I belong to? Because I'm imagining that if you are here at this webinar, you will be able to identify with one of these 4 groups. So how can we support these groups? And that was actually a project that took place from 2012 to 2015, where we developed 4 toolkits for these 4 groups. So for funders, we have toolkit 1. And here we say that quality standards can help them select high quality drug prevention activities for financial support. And you will find here some checklists and questions that can help you make decisions about which projects to fund. But often it's not as simple as that. It's not a simple yes, no question. This should be funded, this should not be funded. So they also help you to identify the stronger and weaker aspects of prevention initiatives so that you can give helpful feedback. You could say, okay, we're going to fund this, but I want you to address this weaker part of your application. You can also use quality standards to write and revise funding criteria, funding mechanism, budgets, and calls for tenders, because often the projects that we receive reflect what we advertised, so to speak. So, for example, if your budgets, if you don't include any evaluation budget, there will be no evaluations. Or if you're just giving really small budgets because you want to fund as many activities as possible, then you might end up with many activities that are not of very good quality because the money for each individual activity was not sufficient to really do good work. It also includes some arguments to help you advocate for evidence-based policymaking and to say no, not just to drugs, but also to ineffective approaches. And here, this is really important, even if they're considered popular. And we have real-life examples of how governments have used this. For example, the Croatian government for a while supported funded projects to achieve the standards. So they would assess the projects using the standards, and then they would offer training to help the funded projects improve their work and to adhere to the standards better. For practitioners, the quality standards and the toolkit too can help you to understand and communicate the conditions needed for effective prevention work. Who are you communicating this to? Well, for example, the decision makers. You can tell them, well, the quality standards say I need to do this, this, and this, so this is why I need this amount of money. They can help you plan new prevention activities. You can use them as a checklist to check if you have considered everything. Again, useful when applying for project funding, because you can say that you have been referring to quality standards and you can evidence that you have thought of everything. You can use them to review existing prevention activities, what is already in line with the standards, where can you do more, and really it's up to you and your working style and your creativity to think about how you might work with these documents. You can use them for self-reflection and self-assessment, for individual projects, people, organizations. They can help you have structured discussions within your team or between teams, especially if teams or organizations use different frameworks. It can be a useful framework to share, to have a joint discussion. And it can also help you develop your own project management and quality assurance tools. And they have been used like that, for example, in Belgium and in Austria. They're also used as a kind of informal checklist that you don't have to share with anyone. It's just for yourself. There was a recent project, Phoenix EU, which also provides some additional resources specifically for practitioners, and it has another toolkit which is called an implementation toolkit. So I'll take a sip of water. You think a little bit about what I've spoke so far. And here we have EDPQS Toolkit 3, which is for the educators. So in the Toolkit 3, you will actually find some of the slides that I'm presenting today, and you have permission to use these slides to talk about prevention quality standards. So you're welcome. And can that be helpful for? It can help you to clarify what prevention is and what it's trying to achieve and what it isn't and what it's not trying to achieve. It can help you talk about equality in prevention, and the quality standards themselves can be used to help students, to train students about how to plan and review prevention projects using a structured approach. And for example, in Italy at the university, they have been used in that way. So you could go through each project stage in one module, for example, at university. And overall, they're also being used at the European prevention curriculum in that way, and especially to develop a shared understanding and professional language around prevention. And this is what I meant before about being creative. So it's really up to you. They are so versatile in so many ways in which you can use them. One of the things that we used to do as well in workshops that I've done in the past is where we use the quick guide, and we use example projects to discuss, or they're fictional projects, to discuss how the standards could be used to identify the strong aspects, the weaker aspects, and then in small groups, people can discuss it and, for example, make notes on the current position, and maybe also then complete some actions to take. I didn't include all the examples here, but I hope that you get the idea of how you could start working through something like this. So if you're interested in this kind of approach, you will be happy with our quick guide. And EDPQS Toolkit 4 is for the prevention coordinators and advocates for quality and prevention. And this is really about how to develop quality standards, how to promote quality from a strategic point of view, how to communicate with others about what you're trying to achieve with quality standards. And real life examples are actually included in the toolkit. We have 8 examples. As I mentioned before, Rasha asked me to talk a little bit about practical considerations if you wanted to develop your own quality standards, if you've been listening and thinking, this sounds great, but we're not in Europe and we don't have something similar. By the way, check, because oftentimes you may find that there are actually quality standards at a national level or at a regional level, or maybe from a professional society, and that you're just not aware of them. Because that happens to us often. When we talk about the European quality standards, many people still don't know in Europe that they exist. So always make sure to check first before you start developing something of your own. But it might be that you want to develop something just for your own organization or for a specific project, or like I said, if you wanted to revise funding criteria or develop funding criteria. And this is where the EDPQS Toolkit 4 really, that's what it's really designed for. It offers a step-by-step guide to doing that with worksheets. It will help you get a better idea of what resources you need. It emphasizes that you need to involve a broad range of stakeholders in the development process. So the worst thing you can do is to have two people sitting in a room and writing a list of quality standards. That is not going to work. You need to involve decision makers, practitioners, to make sure that you get the language right, that you've captured the right ideas, to get the correct buy-in as well from them. Because if you involve them in the development of quality standards, they're much more likely to identify with these standards and to use them afterwards as well. So involve the people that you want, who should be using the standards afterwards. Involve them during the development process, and that way you will engage them from the very beginning. It will highlight so the toolkit will highlight some potential barriers and facilitators that you should keep in mind, and it also distinguishes different types of adaptation. I think we kind of made up these words at the time. We talked about language adaptation, which basically means you're just translating standards. You're doing a formal content adaptation where you, for example, take the EDPQS very strictly and adapt them to your country, for example, or a flexible content where adaptation where it's kind of, yeah, we read through the standards and we took some bits that we liked and we let it inspire us, but it's not really supposed to be an adaptation of the EDPQS. It's more just like we found it useful to develop our own material. And depending on this level of adaptation, of course, you need to follow different rules. So if you're doing a formal content adaptation, you need to be more careful in terms of what changes to the original standards are acceptable, as opposed to if you're just using them for inspiration, let's say. It will also talk about what to consider when translating standards. Again, don't make a mistake and use a random translation company. People have done that in the past, and it's a waste of money because they will not use the correct terminology. Now we have AI-assisted translation, which in some cases can be better in a sense, but you still need to involve stakeholders to make sure that the terminology is correct. And if you have a translation agency that specializes in public health, please use that. And I'm saying that also because I think it's also important to support humans and not just machines. And finally, you will also find something about disseminating standards and how to promote their implementation. So all of this you will find in this toolkit. And on a personal note, or something that I've learned looking back, is that it's really important to think from the beginning, how are we going to integrate them into our system? Are we going to put them into some frameworks, ongoing training, so like we do now with the UPC? Can we put them into some sort of funding mechanisms? Where are these standards going to live afterwards? Where are they going to be alive? The worst thing that can happen is you develop standards and then they end up in a drawer somewhere. So make sure that from the beginning you think about, where am I going to anchor them so that they remain alive after the project to develop them has finished. If I was to develop standards now, I would certainly say that the content of the EDPQS remains valid and relevant. I may have a conflict of interest here because I developed them, so of course I'm going to say they're valid and relevant, but I actually believe that as well. And if you look through them, you will find that that statement is true. However, in the last 15 years, there have been some relevant developments that might lead to additional standards if we were to do that same exercise again now. We had the pandemic, and that has spurred an incredible advance in technology, like use of technology to deliver interventions. So many interventions now exist that are done digitally, and that was not really in the EDPQS. So you'd have to think about, do we need additional standards that cover the digital intervention delivery, for example? There's been a big discussion about how the brain works, but also I'm thinking about cognitive biases. And with that came a big push towards environmental prevention approaches, for example, automatic processes, nudging, if any of those things mean something to you. And this is, again, not something that's really reflected in the standards. The standards are more about interventions that target people directly rather than the environments that they live in. So there could be more around this. Also, we have registries for prevention now established. So again, I'm just giving some examples of things that I might think about. Is there something that I need to consider in the standards? You know, what standards do they use? Can I use those standards to update the EDPQS? Gambling, suicide prevention, all the other preventions, mental health promotion. Do we need to foster greater synergies with them? Violence prevention. Should we make standards that are not just for substance use prevention, but cover those areas as well? Participatory approaches, how do we involve target populations? It is in the standards, it might be stronger emphasized. Topics like gender or health equity, or for example, the climate change and planetary health. Depending on the cultural context you're in, it might be relevant to consider this in the standards. So we're also reflecting on greater societal developments rather than just what's happening in the prevention field. And if we look to the future, aspects like the future of AI and how it will impact on prevention, or personalized prevention. So that these are topics that we didn't explore in the EDPQS and that we might think about now. But this is really, quite advanced stuff, but I thought it was important to mention. And on a very basic level, something that we should have done in the EDPQS in hindsight is to be much more specific about what variables and factors you should consider and collect data on when you do data collection for evaluation, because this is something that's still where there's still a lot of confusion around this topic. So maybe we should have been more direct. Again, I will leave this now, so I don't want to go into too much detail. So brief reflections, and I'm coming to a close for this talk. I'm sure Rasha's already nervously looking at the clock. It's been 15 years since the EDPQS were published. What has been achieved? I mentioned already, we've had follow-up projects. They were adopted by the EU member states as minimum quality standards. They're now being promoted through the European prevention curriculum in over 20 countries. It's also worth mentioning that they are part of the EU drug strategies and action plans. And overall, I think that the awareness and acceptance of quality standards, as well as the readiness to say no to approaches that do not represent high quality, has increased and is improving compared to what the situation was like 15 years ago. But there are still challenges that remain, such as we still see poor prevention projects being implemented in practice. And one of the things that is probably most problematic is that the funding criteria and procedures have largely remained unchanged. So we've been, in a way, we've been better at engaging practitioners rather than funding bodies. So that's also something that you can think about as you move ahead, thinking about quality standards in your own context. So what is the takeaway here? I hope I've managed to convince you that quality standards are useful and important. They clarify what we should expect from prevention. Think of them as benchmarks that we should all aspire to. They offer us a shared framework to talk about prevention with each other, regardless of discipline or country or other context. They can help us distinguish between better and worse prevention work, or aspects thereof. So within the same project, sometimes we have a certain aspect that is well developed and another aspect that is not so well developed. That's also the key aspect if you're just starting, for example, and you feel overwhelmed, you can do a general assessment using Toolkit 2 to figure out, okay, what is the area where I should improve, and then just start with that area, for example. So you don't feel that you should be overwhelmed to try and achieve everything at the same time. Key factors for why the standards are still relevant after 15 years. Well, obviously, I put in a lot of work into it, as did my colleagues, and they were developed through a rigorous process. And I think that rigorous process shows in the standards. You can see that a lot of effort was put into them. And so that has been one aspect, I think, of why they're still being used today. But also there's been all this follow-on work. So people continued applying for projects to continue making them relevant, to continue talking about them. And I'm highlighting both of these things, not just to tell you how fantastic I am, but just to give you an idea of, if you are doing something like that in your country or in your setting, think about these things. Make sure that the standards are good, because if they're not very good, people are not going to use them. And also think ahead about what kind of additional work will you need to do afterwards, so that they keep being relevant, so that they don't just gather dust and disappear. And here's something we always say in these presentations: think of EDPQS next time you select or review prevention activities. So there, I've planted this seed in your head, EDPQS. I hope you remember this. This stands for European Drug Prevention Quality Standards. So we're moving on to the Q&A. Some questions that I will give you as a homework, or we can discuss now. What is the minimum quality that you expect from a prevention activity? Has that changed as a result of hearing this talk? What criteria, checklists, etc. do you already work with? How do they differ from the EDPQS? Take some time to think through these things. And to what extent do funding criteria and procedures in your country or region actually promote quality and prevention? So this is something for you to think about. I mentioned I would show the website where you can download all this information. You will find it at the EUDA, so that's the European Union Drugs Agency website. And then just thank you very much for your attention and for listening to me talk about quality standards for 40 minutes, which is, you deserve the applause here. Thank you.
Thank you so much, Angelina, for such an excellent and insightful presentation. It was truly valuable to see how you clearly explained the development of EDPQS, the structure, and as well the practical application. So everyone has been quite engaged with the topic, which is fantastic. We are now going to begin answering the questions. As a reminder, you can still submit questions through the questions pane. So we are looking forward to receiving any additional questions you have. So let's get right into it with our first question. Looking ahead, how do you see, Angelina, the role of quality standards evolving in global prevention systems over the next decade? For those asking about the presentation, we will be posting the webinar and the presentation on our website. And regarding the email of the speaker, I can share it with you on the chat now.
Oh, sorry, Rush, I got kicked out. I'm back in.
No worries. We were waiting for you. So people are asking if they can get the presentation. We will put it on our website. Mm-hmm. And then I'll go into our first question. Yes. Looking ahead, how do you see the role of quality standards evolving in global prevention systems over the next decade?
Okay, I think standards will become, well, standards will be, the reason why they became so important in Europe actually was that if you have a lot of money, you spend the money and you don't really think so much about what is happening with this money. Suddenly you have, say, a recession, And as we know, prevention, unfortunately, and public health are always some of the first areas where funding cuts appear. And then, as a positive side effect of an unfortunate development, you start to think about, what am I actually spending this money on? So you become a lot more careful to spend it on things that actually work and that will have an outcome. So keeping in mind everything that's going on in the world right now, and in general, the crisis that we've had, the funding cuts that are occurring, I think quality standards will become more and more important for guiding decisions about what kind of prevention activities to implement. Or at least that's my hope. We should be doing this even without funding cuts, but they are an incentive to engage with this kind of work.
Yes, building on this broader vision of the future, we hope so. People are asking also about if this model is applicable in the Middle East context, given the limited availability of evidence-based prevention programs demonstrating effectiveness.
So this is a question about whether something developed in Europe could be relevant also outside of Europe. I think this is exactly that point where I was talking about adaptation. So what would happen ideally? So I would say that yes, most of it will be relevant, but it would still require some adaptation, even if that adaptation just means you get a group of stakeholders together and you look through the standards together to discuss which of these parts are applicable, or if there are other parts that maybe should be added, or in terms of the vocabulary or something like that. But the general principles, and I should mention that we didn't just use European documents to develop the standards, we also used materials from the US, for example, and from Canada. So they are more global in that sense. But yeah, I mean, if you look through them, it will be up to you to decide, really. But in principle, they reflect general principles about how to do good prevention work. So I would assume that they would be relevant, not just outside of Europe. It was a European project, and we only asked European practitioners and decision makers to contribute. So that's why they're the European standards. Yeah.
Yes, I do second that. Thank you, Angelina. I go into another question. In what ways does the EDPQS facilitate measurable improvements in prevention outcomes? And what specific indicators should African programs prioritize to evaluate success?
Okay, that's a very good question. I can see that the person who asked that has thought a lot about these kinds of topics. So thank you for that. So unfortunately, we've not yet had a project that demonstrates in measurable terms the improvements of using quality standards. However, the standards themselves have effectiveness embedded in them because they force you to use evidence-based projects. They are also based on insights from implementation science about making projects work better. So it is plausible to assume that if you follow the standards, the project that you're going to come up with will have better outcomes than a project that doesn't follow these standards at all. Even if we have no, so to speak, empirical evidence to quantify this statement. What is also interesting about the standards is that they do not focus solely on outcomes, but they also include aspects such as ethics, for which we can only have that based on expert consensus about what is ethical drug prevention. So that's another interesting consideration about the standards there. In terms of specific outcome indicators, I think the main point that I always want to raise is that just don't focus on participant satisfaction, don't focus on how many sessions you did. These are not valid outcome indicators. Don't focus on increased awareness and increased knowledge on drugs. So these are the kind of 4 things that I would like you to not focus on. Focus on other things like, for example, improved functioning in the family, improved communication and functioning in the school, improved impulse control. So you'll have to think about what is your theoretical model that guides your intervention, what are the relevant variables, and ideally, you know, also measure decreases in cigarette and alcohol use. It really depends on the project. I think what I'm trying to say is you will have to think about that carefully for your own project, but don't use increased awareness and increased information about drugs as your main indicators, or, you know, like we did 500 sessions or something like that. They're not valid indicators.
Thank you for clarifying this, Angelina. And then one question about considering the risk factors are largely not specific and exclusive to the consumption of psychoactive substances, combined with the whole set of addictive behaviors without substances, plus all the evidence based in epigenetics and neuroscience. Would it not be pertinent to and appropriate to shift the paradigm of prevention focused on the consumption of psychoactive substances to the prevention of addictive behavior?
Yes, so that's what I was trying to show in that slide where I talked about if I was to develop standards now, and I showed that card deck and I was talking about gambling prevention. So that's exactly the point. And I think the reason why these are substance use prevention standards doesn't reflect the scientific evidence base or approach. It reflects how drugs are organized by government. Like we have, for example, one ministry deals with alcohol, another department deals with tobacco, another ministry deals with gambling, another area deals with suicide prevention, and often the funding is separated. And in this case, the standards were funded by funding call focusing on substance use prevention. So that's why I'm saying if we were to develop standards now, and you know, you were asking me about are they applicable to the Middle East? They are also applicable to other types of prevention projects, not just substance use prevention projects. There will be many things in there because at the end of the day, it's a more like a project management approach. So of course it's applicable to other public health activities as well. And yes, in an ideal world, it would have been a more integrated approach. So that's also something you can consider, of course. Yeah.
Yes. I'm checking additional questions. Okay, are there any upcoming considerations of quality standards development for the integration and use of AI, machine learning, deep learning in the framework of substance use prevention?
That is a very good question. I have not myself had time to really think about this yet or to discuss this with colleagues. Like I said, I've been thinking more about digital approaches and what additional considerations there might be. But yes, in terms of AI, one of the things that comes to my mind immediately is, of course, data protection, for example. But also one interesting aspect about AI is that it will, if you ask AI what is effective prevention, it will still give you the wrong answer most of the time. So when I've asked that, it will still talk about information and campaigns and awareness raising. So I'm not exactly sure what the person was thinking of when they wrote this question. Yeah, it's definitely something that should be considered for the future and will become more and more relevant for us. Yeah.
Yes, I do agree. And this is a very important aspect, actually, that we need to consider in the future, as well as the ethics related to it. Okay, I'll take maybe 2 more questions because I know it's time to close the webinar. So one more question saying, how do you get stakeholders, example in education, etc., to adopt the standards and buy into the process?
So this is why we focus so much on training and why the European prevention curriculum has been developed, because we found that if you just, and this is also we know this from science, that if you just distribute materials, it is not an effective way to engage the target audiences. A much more effective way is to do workshops. So we're talking here about professional workshops where we discuss the standards with practitioners and decision makers, to introduce the standards to them, to do exercises about how they might use the standards in their work, to make them more familiar, and so that it moves from something very abstract and theoretical to something where they can see, this is actually helpful for me, so that they have this kind of light bulb moment where they realize, this could actually help me in my work. It's not just a burden or something that will make my life more difficult. So this is the advice I would give there, to make an effort to show how the standards can be used in practice. Yeah.
Yes, definitely. And just to announce that Spanish interpretation will be ending now. So we are so sorry from people who were listening to the Spanish translation. So we will continue the Q&A in English. Okay, I'll just ask you the last question before closing. If a country is starting from scratch, what would be the first practical step?
Sorry. Do you hear me now?
Yes, but we are hearing your voice twice. There's an echo.
There we go. Is it better now?
Yes.
Okay. So this is what I... Oh, wait a second. I'm still hearing myself. A moment. I'm so sorry. How is it now? Do you hear me?
Yes.
Okay, good. So this is what I mentioned before. We have EDPQS Toolkit 2 for practitioners. And there, the colleagues who worked on that, they came up with this idea that you do some sort of self-assessment to identify the areas where you already achieve a lot of the standards and the areas where you're just starting out, so to speak. So it will give you some ideas of where we're already doing a good job, where's still room for improvement. And one simple step would be to just start on one area, for example, and to think about, okay, this area is important to us as a first step. That would be one way to approach it. So it's not too overwhelming. And you will find more ideas like that, I think, in the Phoenix implementation toolkit that I showed as well.
Perfect. Thanks, Angelina, again for answering those questions and for the great presentation. It was a pleasure to have you with us. This concludes the webinar. Thank you all for attending. We hope you learned something new and enjoyed the presentation. You will receive a follow-up email within 24 to 48 hours with a link to view a recording of today's webinar. And we always appreciate your feedback and suggestions. So please use the link in the follow-up email to fill out the feedback survey. And on behalf of ISSUP and our presenter, thank you for joining us today and have a great rest of your day.
Thank you.